So our next speaker is Dr. Lauren Tedaldi, who is the Head of Research and Innovation Communications at Great Ormond Street. Lauren will talk to us about some of the comms and engagement work that the team do that help the BRC's work to have global and national impact.
Good afternoon, everybody. My name is Lauren Tedaldi, and I am Head of Research and Innovation Communications here at Great Ormond Street Hospital. As you can gather by the fact that you're listening to a recording of me, I'm not able to speak with you today, unfortunately, but there are members of my team in the audience who can hopefully speak to any questions you might have. And what I'm going to be talking to you about today is our work in communications and engagement on research and innovation, particularly around accessibility. And what we mean by accessibility for the purposes of this talk is helping people to see how they can be part of the research and innovation story. So as I mentioned, we're a communications and engagement team, and communications loosely brings the inspiration and the wonder or the amazing work that you've seen today. For example, we help people get their socks firmly blown off. But a really important part of our work is also the engagement. And I like to think of the engagement side as helping people find their place. So where is my place in this? How do I see myself in this story of wonder? And that's really what I'm going to talk to you about today. And I'm going to show two examples of where I think we've managed to achieve that, and then talk through some hopes for the future. So I'm going to start with some things I'm sure you've seen in the national press and the international media, which is the classic story of world-renowned professor makes breakthrough. The first child receives the first treatment on a brand new clinical trial. And these are truly incredible stories, and they're not going to go away, we hope. I'm certainly not here to tell you that we're going to stop telling stories like these. But what these stories don't do is allow people to think, where is their place in this? Unless you happen to be a world-leading professor, which many of you in this room are. But let's pretend for a second that we're not all there. So how do you see yourself in this place if you're just starting out or you haven't even managed to publish your first paper? And I like to call this telling stories from the whole family. So if you think about any family, functional or dysfunctional, and hopefully you recognise some of these that I'm showing you now, you can decide which are the functional, which are the dysfunctional, and which ones represent research and innovation. So if we think of research and innovation as a family, we need to tell the whole stories. We can't just tell Homer Simpson. We need to know what's happening to Bart, Maggie, Lisa, and everybody makes up the story of the family. And we lose out if we don't hear from everybody. So in order to tell stories from the whole family of researchers and innovators, we decided to launch an image competition. Funded by the Biomedical Research Centre, we asked staff to bring us their best images of discovery. And we focused on the image, not on a piece of innovation funding or a research milestone or a paper, but just on the power of the image alone. And that allowed us to reach more staff, raise their voices, raise their work, and also share that with the national and international media. Now, this wouldn't be a talk with the NIHR present if I didn't talk about impact. So I've got two slides for you now on impact. One that covers what we did outputs, and one what that meant for some of our stakeholders. So in the last 4 competitions, we've had 4 winners and 12 favourites. Each year we have 3 favourites and they get voted on. That could be by peers across the BRC, it could be on social media. We've managed to use our staff network some years, our young people's groups, everybody gets involved. It's really, really great fun. We've had interest in national and international media, and we've even been featured 4 times in Nature magazine. Yes, Nature. And we've had exhibitions and been used in partners' materials. So we create these exhibitions that showcase the work, we tour them around the hospital, and you can see here an example. So our charity, Great Ormond Street Hospital Children's Charity, they actually use Jade, one of our amazing research nurses, her drawing of a closer look at research as the inspiration for the cover, and they work with Jade to adapt that. So it's really been a wonderful way to raise her work. But in terms of accessibility, what's been really, really validating is that we've been able to work really closely with 49 researchers across the competitions, work with them on lay summaries, how to talk about their work, how we're going to share their work, including them in press releases. We've had all manner of staff roles and all manner of experience represented, from professors to PhD students to people who haven't really even begun to take their first steps, but they're just thinking about research and innovation and what it could mean for them, and that's been really gratifying. We've covered over 30 disease areas and raised the profiles of all manner of rare diseases, from eyes and kidneys and brains and spines, you name it, it's been there. And also really varied images. So you can see here an example of some microscopy, some photography, some data, some graphs, some simulations, even some images of things that didn't exist yet, but we were hoping to do. We've represented the whole pipeline of research. So we've had work that's not been published, work that's been published and been adapted for the competition. We've also even had the competition won by a mistake. As we know, sometimes even mistakes can be very beautiful, very impactful. And then certainly, last but not least, we've managed to build up some new networks. So we've made our way into teams that perhaps wouldn't have been involved with us before, and that's been really, really valuable for us. So now I'm going to talk you through a project that we worked on which references the physical spaces in the hospital and where staff and families can actually see research and innovation. If you're in the Science Centre for Research and you're looking down into the labs on your way to outpatients, it's quite clear where research is. If you're in the CRF and you're in a spaceship's designed clinical room, it can feel very innovative, but it doesn't always show up when you walk through the rest of the parts of the hospital. So we wanted to make sure we were showing people how they could help and how research and innovation helps them. We worked really collaboratively with our estates team, Space in Place, to look for some unused and unloved spaces in the hospital, and also with our Gosh Arts colleagues to make sure nothing was being planned. And we found some really quite interesting options. We decided we wanted to show the synergy between staff, patients, research, innovation and care. So where they are really helping us to drive forward research and innovation, and where research and innovation is really helping in their care. And we worked with patients and families to see what they wanted to see and know as well. We worked off some existing designs that we had, so budget was tight as always, and we had some investment from our BRC and our CRF, and we still wanted to make sure we used our money as cleverly as we could, and we worked off some designs we'd already developed with our staff networks and our patient groups. We wanted to refresh them and make them even more fit for purpose. So again, I want to talk to you about the impact of this project. So over the course of the last 3 to 4 years, because it has taken a lot of blood, sweat and tears, we've had 3 patient lifts installed, 1 staff wall, 5 what we call the family walls, and 24 doors across the hospital that go into those lifts, so on every floor. And essentially those places take direct patients to clinical staff. We don't want them to see distinction between research and care, or innovation and care. And it takes staff with the infrastructure that can support them, either through QR code or naming the places that can support them. The family walls in particular show a complex patient journey, and research and innovation teams are woven right in. They're not separate, they're very much part of that care. And I'm pleased to say they're very diverse and inclusive. So we've got all manner of protected characteristics, staff roles, seniorities represented from our families and our staff. For us as a team, it was really important that over those 3 to 4 years, we regularly and consistently engage and involve with families and staff across hospital, the very audience these things were designed for. And it's really helped us to embed that in our ways of working. We've had really, really good feedback since they've been embedded, whether that's online and through social media, or from staff and in staff launches, from even just children walking past. I sometimes see them pointing and interacting. It's absolutely wonderful to see. We've had really good feedback on the diversity of staff and patients that I mentioned, and our co-chair of the REACH network worked with us, and he was really pleased with the work. We've worked with over 250 staff and over 40 teams, so this is certainly not exhaustive. Could have worked with more. I'm sure there are plenty of teams who wish they were on those walls, and we'll get to them, I'm sure. It's been really, really a big project to involve them all in. We told 4 family stories and worked with 6 patients. So 2 of those families had 2 siblings who had different journeys with us, and we were able to share that information through those walls. So it's really, really been wonderful. So I really want to wrap up that project with some other quotes that came through, and this was it's just been so heartwarming. It was a lot of hard work, but whether it's staff being thrilled to have been named and called out for the first time ever, or patients saying this gives them hope. My floating head is covering over the quote of "this gives people hope," and that's a really wonderful thing to be a part of. So this is great, and this can often seem like, well, isn't everything fine and dandy? But we do know we've got work to do, and that's what I want to talk about to wrap up, look into the future. So if I think about things I would love us to do in the future and to build on, I'd love us to work more with families with complex stories and complex needs. So more recently, we've worked with families with complex learning disabilities and families with baby loss. We know these are really important stories to tell, very, very important for Bosch, but important across the country and across the world. So what can we do to develop our approach there? We want to learn from our partners. We have charity partners, journalists, and the universities that we couldn't do our work without certainly in comms, and then also do you. So what can we learn from the way that they're doing their work? We want to showcase alternatives for people. So maybe comms or media isn't quite right for them, but could they work with, I don't know, business development to support their work? We recently had a survey, and we're developing a newsletter for our staff that's not just celebrating the good, and of course there is some of that, but also telling them how we're going to improve things for them and engage with them as a community. We want to engage with our communities in a really meaningful way. So it's fun to do engagement events where we play with glitter with children to demonstrate the lab. But how can we get the most out of that engagement so it's really meaningful? We want to build our networks. So we've got research champions and innovation officers across hospital, and they're really embedded in their teams. And we know that people respond best and want information about research and research and innovation from people in their teams. So how do we use these networks to get that information out to them? And also the emergence of AI. So you can't go very far these days without a new AI product popping up. But how we're already using AI to look at how we can make our web pages more accessible. But how could we be using AI perhaps in the future to either free us up to do more in-depth work where we need a bit more nuance, or could it be teaching us some new things? So all that remains for me to do is say thank you very much for listening to me for the last 10-12 minutes, but to also thank the teams who made the work you've been seeing possible. So the Research, Innovation, Communications and Engagement team at the moment is myself, Daisy Holden and Ellie Sullivan, but this presentation has been based very much on the work of Gigi Hill, Chloe Goldman and Fiona Calvert, and Fiona Calvert in particular deserves a shout out for 5 AM starts with lift installs and tears when things have fallen off those walls. She now supports us more broadly with the North Thames Genomic Medicine Service. We're funded by the BRC, our R&I Directorate and Gosh Drive, and I've listed just a few of the teams who've helped us put up the family walls in particular, who have really been instrumental in that complex project. But it's worth, I think, finishing with a big thank you to all the research and innovation active or interested staff, but also the patients, families and carers who share their stories with us. And it genuinely is a privilege of telling all of your stories in any way that we can. So thank you very much.
Thank you so much, Lauren, and it's a shame that she can't be here, but I know that Lauren would be very pleased and happy to answer any questions if you would like to reach out to her, and I know that I feel very proud when I walk past the family walls. It's that NASA moment, but it's also how we work with all of our partners in this room.